Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we've got a great healing exercise for spondylolisthesis of the lower back known as Sumo stance, posterior pelvic tilting. Hope you enjoy. So if you've seen any of our other videos on spondylolisthesis here on the channel, you know that one of the main complicating causes of spondylolisthesis is what we call an anterior pelvic tilt posture, where the pubic bone is lower than the tailbone. When this happens, it increases the curve in the lower back, and it compresses the back side of the spine, including the facet joints, sacroiliac joint compression, the back portion of the disc fibers. Many times creates an entrapment synovitis in the facet joints, which cause a lot of the pain in spondylolisthesis. Now, other videos that you'll find, including on this channel, address key components of correcting this pelvic tilt or anterior pelvic tilt posture. And those are strengthen the abdominals, especially the function of the lower abdominals to pull the pubic bone up and tuck the tail under, which decreases the arch in the back. Videos that we have pertaining to the lower erector spinae, like the iliocostalis and longissimus, that exert a posterior rearward tension on the lower vertebra to hold it in a more stable position and avoid the anterior translation or the forward slippage tendency of spondylolisthesis vertebra. And other videos that discuss hip hiking and hip rotation, torso side leaning, latissimus involvement. But a key component that many people don't realize is what's going on with the adductor muscles of the thigh. These are muscles that come from the thigh up and attach to the pelvis around the pubic bone that many times in cases of spondylolisthesis of the lower back become tight, and their effect of tightness actually helps to pull that pubic bone down or tail up, which accentuates that dangerous overarching in the lower back curve. So one way that we can stretch these that dynamically encompasses abdominal usage with the stretch, as opposed to just putting your leg out to the side, there are plenty of stretches that do that, is what we call a sumo stance pelvic tilt. And what we do is we're going to take a wide stance, wide enough for you to feel a slight pull or stretch somewhere in the inside of your thigh muscles. Again, as I take a wider stance, I'm going to make sure my feet are angled out. If I have a tendency to externally rotate one hip more than another, meaning walk or stand with one foot out, I want to make sure that foot isn't angled out more than another. Otherwise, as we're doing this, we're only enhancing that dysfunctional state. We're training dysfunction. We always want to train proper function, not dysfunction, in good healing exercises. Once I have a width that I can feel a mild pull, I'm then going to tuck my tailbone under. Now, here's the thing about sumo stances. If you put your feet together and tuck your tail under, you're going to notice that's a lot easier to do, and there's a lot less resistance to tucking the tail under. When we separate our legs, we naturally have a tendency to drop the pubic bone and raise the tailbone because those tight hip adductor muscles are actually pulling on the front of our pelvis. It's pulling it down. So as we separate those legs and go into the pelvic tilt, we just want to tilt under enough where we feel a slight accentuation of that slight stretch we felt when we separated our legs. And we're going to hold that for 15 to 60 seconds. Again, as you're doing this, you're making sure you're not hip hiking, raising one leg up. You're making sure you're not having a tendency to twist your pelvis to one side, which would overstretch one side of the hip adductors and shorten another. You're making sure you're not laterally tilting to one side if that's your tendency. Again, if you don't know what your tendencies are with your pelvis and your rib cage and your lower back, I invite you to go to either the Pain Free and Fit or Posturesize websites, take the free body analysis, learn what your unique posture and mechanical issues are, so that while you're doing this healing exercise or any of the others on the channel, you're strengthening the proper function of your body and not increasing the dysfunction, strengthening bad habits. Once that stretch sensation has abated, meaning it's actually disappeared, I don't feel the stretch anymore, that should happen somewhere between 15 seconds and a minute, I'm then going to separate my feet slightly more. I'm going to move them out, maybe another ½ inch or inch, and I'll feel again that stretch occur on the inside of that thigh. On both sides, one side perhaps greater than another. It wouldn't surprise me if the side that you feel greater is the side that you usually cross that leg over or have a tendency to bring that leg more towards your midline than another in your daily habits. Again, I'm going to tuck the tail under again until I feel a slight accentuation of that stretch. Every time I tuck the tail under, I'm only looking for a slight accentuation of that stretch. Stretching has to be mild. If we stretch too far, too vigorously, if we feel a major stretch going on, that's going to elicit a response from our muscle spindles, which are receptors in our muscles that are monitoring the tension. If we have too much of a stretch, those muscle spindles are going to send a message back to our spinal cord saying, the stretch is too great, let's tighten those muscles to protect them because they may be damaged. We don't want to elicit a muscle spindle response. So keep your stretches mild. It's much better to do 3 or 4 or 5 mini stretches to get the same range of motion and stretching rather than try to make it all happen in 1 or 2 stretches where you have a great stretch. Another 15 seconds that's released, I can separate my legs a little more, my feet a little wider apart. Again, I feel that stretch again happen and a little bit of tail under, feeling that stretch accentuate. So each phase you're going to go, and you can go between 3 to 5 different stretches or different levels of separating your legs. You're going to be opening up the tightness on the hip adductors. That's going to reduce the pulling on the pubic bone down and allow you to keep your pelvis in a more neutral position, which decreases that compression or overarching stress on the spondylolisthesis vertebra, helping to alleviate your pain. If you enjoyed this video and would like to share and help me share it with others, give me a thumbs up below. If you have any questions or comments, please leave them. I'll do my best to get back to you. Want more videos on spondylolisthesis? Subscribe to our channel. We've got a whole bunch of them. Get more information even on our website. We've got a brand new healing fast track program for spondylolisthesis coming out this July 2018 on the Pain Free and Fit website. It entails this exercise and a whole bunch of others that goes over stretches, mobilization exercises, strengthening condition exercises, and it's tailored so you can customize it for your unique body. I hope that this Sumo stance pelvic tilt stretch helps you with your spondylolisthesis.